Naloxone, also known as Narcan, is an opioid antagonist. So it goes in where the opioid receptors are and where the opioids attach to the receptors and just cause the effects to be intensified. Naloxone comes in, attaches to the receptor, and blocks opioids from being there. And so the indications for use, they're used to reverse most effects of the opioid medications, including respiratory depression, coma, and sedation. So it's a drug of choice with pure opioids. It reverses post-op effects, and you can also use it if you're not sure of what the poisoning is. The great thing about naloxone is that it's not going to hurt you if you use it and you don't have opioids in your system, but it could save your life if you're not sure what it is. Let's see. Okay, it can be administered in 3 ways. You can get it IV, which is the best way if you have that available. It can also be used IM or sub-Q. Now, if you use it if you use it as an IV, the effects begin almost immediately and they persist about an hour. If you use it in the intramuscular or sub-Q, it is going to take effect in about 2 to 5 minutes and it persists for several hours. This drug is eliminated by your liver and the half-life is approximately 2 hours. Other sources will say in about about 90 an hour to 90 minutes, it could go away. Remember, if they are really dependent on this drug and you give that to them, when that half-life goes off and the drug starts to wear off, they're going to start to affect they're going to go into withdrawals. And then when the half-life is over, and then naloxone starts to release from those receptors, then the opioids are still in their system because they last longer than the naloxone, and then they're going to start, and so they could go back into respiratory depression. So you need to be sure that you have that drug available to administer again. Now, they also come in a nasal spray and an auto injector, kind of like that you have for out with the allergies. So it's an auto and you just stab it into their thigh. The one that goes into their thigh, the auto injector, that is only given once. But the spray, one spray is administered to one nostril, delivering 4 milligrams of naloxone. If there is no response, additional doses may be given every 2 to 3 minutes until emergency medical services arrive. The auto injector is a cartridge containing 1 dose of naloxone that is delivered to muscles or the skin of the outer thigh. The cartridge uses an electrical voice instruction and blinking lights to help guide the caregiver through proper administration. So remember, nasal spray, additional doses may be administered every 2 to 3 minutes until additional medical support arrives, but the auto injector is 1 dose. If you're in the hospital, the initial dose is 0.4 milligrams for adults and 10 micrograms for kids per kilogram. The preferred route is IV. However, if IV administration is not possible, then intramuscular or sub-Q injection may be employed. Dosing is repeated every 2 to 3 minute intervals until a satisfactory response has been achieved. Additional doses may be needed at a 1 to 2 hour intervals for up to 72 hours depending on the duration of the offending opioid. Now if they're post-op, and you can do an IV, consists of 1 to 2 milligrams IV repeated every 2 to 3 minutes until the adequate response has been achieved. Additional doses may be required for 1 to 2 hours. If it's a neonate, the initial dose is 10 micrograms, and it's repeated every 2 to 3 minutes until they get better. Remember, the dosage must be carefully titrated when treating toxicity in opioid addicts. Treatment should be initiated with a series of small doses rather than one large dose. The half-life of naloxone is shorter than most opioids' half-lives. Therefore, further administration of naloxone is often required. I read, it says, administration of Okay, it says that dosages must be carefully titrated when treating toxicity in opioid addicts because the degree of physical dependence in these individuals is usually high, and hence an excessive dose of naloxone can transport the patient from a state of poisoning to one of acute withdrawal. Okay, so you're watching the patient carefully for closely return of respiratory depression as the naloxone wears off and the opioids start to reattach to those receptors again. Women should delay breastfeeding until medication is out of her system. Do not give to a woman or newborn if the woman is opioid dependent because abrupt withdrawal in both. Of course, if they are in respiratory depression or it looks like that they're not going to be able to breathe on their own from the opioid drug, then naloxone should be administered to restore respirations. So what happens when you reverse these, it could put them into a seizure. So then you're going to want to watch for seizure precautions. And that is why dependent women, those moms, if they've been on an opioid and you give that to them, then they're going to go into withdrawal symptoms. So if it's life altering, you're going to want to give it. But just normally you may not if it's just because they're sedate, feeling tired and drowsy.